Hi everyone, my name is Samantha and I did my presentation on shoulder labral tears. So background and common mechanism of injury. The shoulder labrum or glenoid labrum is a fibrocartilaginous structure that forms a ridge around the glenoid fossa, deepening this cavity. Because the labrum essentially heightens the cavity, it allows the humeral head to sit deeper into the fossa, providing more support and stabilization to the joint. A few common ways that I found patients tear their labrum in different types of tears are one, slap injury. So slap stands for superior labrum tear extending from anterior to posterior. And it's common for athletes in baseball, volleyball, and swimming to experience this injury because of the repetitive abduction external rotation, which causes stress on the biceps tendon and basically peels the labrum from the glenoid. So slap injuries can also be a result of falling on an outstretched arm. And another type of labral tear is called a Bankart lesion, and this lesion is of the anterior inferior portion of the labrum and is caused by repeated anterior luxations and subluxations. So I like this picture on the bottom because it shows the difference between the slap tear and a Bankart tear. The top picture is a slap tear because it shows that the tear is extending from 10 to 2 on a clock or anterior to posterior. And this is around where the biceps tendon attaches, so that makes sense. And the bottom right picture is of a Bankart tear, and this is because it extends from 3 to 6 on the clock or anterior to inferior, which is where the humeral head will dislocate. So typical presentation, while I was researching this topic, I found a few common symptoms and complaints that are common to patients with labral tears. And it's common for them to complain of pain with overhead activities like reaching into high cabinets or raising their arms when dressing. And for athletes, it's painful to rear back when throwing the ball, or for swimmers reaching over their head. And more common complaints are the feeling of instability, and they might hear sounds of clicking or popping when they move. For objective findings, range of motion testing is used to look for any deficits in planes of movement. And you can also use a crank test, biceps load test, jerks test, and Kim's test are all tests that are used to assess labral tears. And if these tests are positive for a labral tear, it will reproduce the symptoms and will cause slight pain in the patient. And that picture of the football player is actually my brother. So general prognosis. The prognosis for patients with shoulder labral tears will depend on the severity of the injury and the type of intervention they receive. So if the patient receives surgery to repair the lesion, the surgical procedure is followed up with post-op rehab. And during this rehab process, the aim is to restore range of motion, strength, and stability of the glenohumeral joint. It is possible for patients to not receive surgery, but the likelihood that they will experience an increased pain and increased limitations is likely. So the overall goal is for the patients to restore functional activity in a timely manner. According to a study done on 123 patients with labral tears, they compared operative versus non-operative recovery outcomes. They used the pain visual analog scale, like on the screen, as their main outcome measure and measured this for patients at baseline, 6 months, 12 months, and 2 years. And the overall results of the study were that patients who received the surgical procedure to repair the labrum had significant improvements in pain from their baseline score to the 2 years compared to those who did not receive the surgical intervention. So evidence-based treatment recommendations. Treatment recommendations for the labral tears, like I said, will be unique to each patient, but with an overall goal of restoring and enhancing dynamic stability. And so just an overall goal of enhancing that dynamic stability of the shoulder joint. So on the side, you can see I have phase 1 goals and phase 2 goals. Phase 1 goals are to protect the anatomical repair, prevent any side effects of the immobilization, since if they do have the surgery, they will be in a sling for 6 weeks after, to promote dynamic stability and to decrease pain and inflammation. So for phase 2 goals, it is to restore full range of motion, progress to functional activities, and restore muscle strength and balance. So the first exercise I chose for phase 1 of rehab is called the pendulum exercise. And during this exercise, the patient is standing and supported by the uninjured arm on against a table, or if they're at home, a countertop. And the patient bends at the hips around 75 degrees and lets the affected arm hang down towards the ground. And as they are bent over, they should shift their weight forward and back and side to side, allowing the arm to swing in a controlled motion. This exercise promotes healing and allows for range of motion, so there's no side effects of the immobilization without really straining or you having to use those affected tissues. The next exercise I found that is beneficial for patients is active assisted external rotation. And this is beneficial to the patients by enhancing circulation within the joint to promote healing and also decrease the stiffening, like I said, from the immobilization. So during this exercise, the patient is in a supine position with a broom or a cane in their hands, and the affected side is supported with a pillow, like you can see in this picture. The patient's non-affected side should externally rotate the affected side, not going too far where the patient experiences discomfort, since we're still in the phase 1 of rehab, and our goal is to minimize the effects of the immobilization and decrease pain and inflammation, not cause the patient more pain. So the last exercise I chose for phase 1 is pulleys. So like you can see in the picture, the patient holds one end with each hand and allows the unaffected side to pull down on the pulley, allowing the affected side to raise. And this is an active assisted way of stretching the shoulder and decreasing the effects of the immobilization, still in a controlled manner. So with a full can exercise, the patient elevates the upper extremity in the scapular plane with the glenohumeral joint in external rotation. And this exercise is best used to maximize the amount of supraspinatus strengthening, which will help stabilize the shoulder joint. This device is called the upper extremity ranger, and with this is a great tool to use to help improve range of motion and strength while still providing the support to the joint. And when I was observing during practicum, the PT used this for a lot of her shoulder patients, so I thought that was cool. And the upper extremity ranger is a grip-free tool, so they just slide their hand into the hand support, and that allows the patient to easily, in this case, flex and abduct the shoulder without co-contracting muscles that, if you were having to use a weight, that gripping would cause. So the last set of exercise for phase 2 of rehab that I found is a program called Throwers 10. And this program is mainly used for athletes who are recovering from a labral tear or really, honestly, any shoulder injury. And this program has 10 sets of exercises that are directed towards improving strength, endurance, and power of the muscles used during the throwing movement. So for this program, there's more than 10 exercises. It's more like 10 groups of exercises, but the top left is diagonal extension, top right is diagonal flexion, bottom left is external rotation, bottom right is internal rotation, and those are all used with bands. The next set is internal rotation at 90 degrees, external rotation at 90 degrees, scaption, so that's the full can exercise I told you about earlier, and abduction to 90 degrees. And this set is side lying external rotation, prone horizontal abduction, prone rowing, and prone abduction. So we have elbow flexion, push-ups, press-ups, prone rowing into external rotation, and elbow extension, wrist extension and flexion, pronation and supination. And I just thought this was a cool program since we will probably be working with a lot of athletes, and this is a great tool to use if they have, if they're recovering from any type of shoulder injury. And these are my resources. Thank you.